Hello, dear colleagues. I hope you're okay. Once again, hello. Case number 4. Gentleman, 65 years old, quite young, with ACOM aneurysm. And aneurysm has small daughter sac, and I hope you agree. There is no doubt about the treatment. Treatment should be. And we did angiography from the right side. It looked like good ACOM, but pericallosal artery is coming from the side, but it's still communicating right and left. Now you can see there is a connection between pericallosal and non-pericallosal. My friend Nurjan is calling. I'm so sorry. I need to answer him. Можно звук выключить пока. Yes, my friend and student fellow Nurjan is called me, and I tried to explain that we are on the treatment. There is a washout in AC pericallosal on the right side. The both AC is pericallosals coming from the left ACA mostly, and this aneurysm nearly 2.5 millimeter with the proximal IC tortuosity. I hope we can deal with this territory. A1 is friendly. We will take a scepter balloon and the headway 17. We'll place a coil and stent. Okay, through the scepter balloon. Okay. The Leo BB 225 is available. Нам просто ден такой сон, Саш Петратумс. As the headway 17 is better, and the scepter 415. Чекай black. Fin, 45 degree will be better, and okay, let's take a Traxxas. Okay. Traxxas we will use for the scepter, and Chikai black will be inside the headway 17. Yes, the alternative option for such kind of aneurysm could be just a flow diverter placement in ACA, and then aneurysm will shrink and disappear. Unfortunately, FD in small size is not available, and till the next year I'm not sure it will be available. That's why the option number 1 is stent assist coiling, balloon assist coiling, and then stenting. Also with the Leo BB 2.5, 2 millimeter, we may create a FD from the low profile braided stent. Okay. Chef may place the tube in this position. Так, headway до нига бросна. Yes, my name is Mynzhylky Berdikhojayev. My assistant, Sheikh Ahmed Mohammed Khan. Mohammed Khan is last name. Контраст құя саласыздар ғой. Ана физраствор мен келем дегенше бітіп қалып жатыр ғой.
Қатты қойып отыр. Ой дейді жайын. Кішкентай.
Осылай, бұрысын. Шо? Алғыр. 3 millimeter, 45 degree. It's a Chica black. And this is Traxist. Ана физраствор переколоть етіп жүре саласыз ғой, Бақыт, е? Бақыт, физраствор переколоть етіп жүре саласыз ғой. Okay, let's prepare the... Мынаны көрдің бе? Физраствор переколоть етіп керек. Дайын болған кезде айтасыз ғой. Все дайын. Устраиваемся. Okay. It's very important to switch the flushing system because the bags with the bottle with the physiological saline is only 500 cc. It's a specificity of the tender system, huh? Yeah, contrast керек. Мына жерге қойып қойып қиылмыз.
Траксас қой, ә?
Ол траксас, иә.
Бұны неге де?
Траксас септірін саламыз. Yes, and for this treatment with the 2 millimeter aneurysm, patient finally in general anesthesia. Yes, for today it's case number 2 with general. The case number 1 we did the general because of the patient's fear from the local anesthesia, and she strongly asked for the general anesthesia, but the treatment was quite fast and it was just stent placement. She destroyed our statistics of local anesthesia. Yes, if it's possible, then better to go with the local anesthesia. Yes, she a little bit confused the statistics of local anesthesia. Okay, now I took a 60% contrast and connected with 3-wave Y connector, stopcock, the balloon, and now inflating the balloon. The dead space with the air inside, and we need to push the air from the system, and there is a small hole on the tip of the balloon and the air will go out, and there are two ways of preparation of the balloon, three ways maybe. One way is to seal the tip of the balloon after the inflation deflation with the hot air or steam. And the second way is this one, and then we put inside the saline, and now we'll deflate the balloon. And way number 3, René Chapeau is using this technique. He's placing inside the water the balloon and then inflating and compressing the balloon with fingers. It helps to save time, couple of minutes, and after he's inflating the balloon inside the ICA territory, in the cervical ICA. But when I'm preparing the balloon in this way, then usually I forgot to inflate, deflate in ICA. But now I want to show you in a traditional way. Okay. Now balloon is ready. Yes, it's ready. It's hermetic, non-damaged, and it's possible to place inside the patient. Okay. Yes, the guiding catheter now inside the common carotid, and I think it's a internal carotid territory. There is a kink, but we passed the kink part, and now I will ask the nimodipine in the flushing system. Nimotop 6 ml промывка хоспоясанши. Yes. After placing the microcatheters, I will bring my guiding a little bit back. But we may cause a spasm. It's not all the time good, but for the navigation, for the distal navigation of the instruments, it's very important. Okay, now we are in the ICA with balloon, and now I will take my headway. Yes, we took a scepter C415 with the Traxxas wire, Traxxas regular 14, and now we will take a headway 17 microcatheter with the Chikai Black. As the next generation of Chikai is Chikai Nexus, is not yet available in our country, but we already discussed with the friend in in Asahi company. His name is Suleiman Jabrailov, about the availability of Chikai Nexus in our country. Maybe till the end of this year we can use the Nexus. And from the comments of Japanese colleagues and friends, Nexus is quite nice instrument. We will see. But we used to work with the Chikai Black, and it's also nice innovation. Yes, we took a traditional soup, and it was a little bit fatty, and I have a gastric problem now. I don't like fatty food, but назад, stop. Yes, The available size of the baby Leo is 2 millimeter by 25. That's why for the longer stand is better to use okay. I think it's better to go to the ipsilateral side, not to the contralateral, to ipsilateral. I have no explanation why it's all the time trying to go only to the aneurysmal side. Now we are in the contralateral. It's good for the navigation, it's okay. Then we can replace the micro. And we can also reshape the tip of the Traxxas 14. Okay, let's reshape it. Before it will do any kind of complication, we need to reshape. It's quite soft, and it's a little bit lost the shape of the tip. We'll give more J. As for some reasons in distal anatomy, in proximal tortuosity, the Traxxas is a good instrument. Okay, let's check is there any spasm. No spasm. Stop. Yes, and it's very important to have 4 screens to control the movement in both projections with the subtracted and unsubtracted view. Okay, now we may control. Okay, now it's better. I think it's enough. Okay, we completely changed the anatomy. I think it's not actual after placing the balloon. This rod knot is not actual. Okay, let's do under again. Жүрегін көтеріп ана сорпа. Я қосып қоясың бақырын. Ана проекциясы өзгеріп кетті ғой деймін да. Мынау қай проекция? 35. И көрсетші. Three right. 22. It's новый smart mask. I don't know why it looks like patient is moving. Наркоз глубокий, да, у нас ощущение, что пациент движется. Yes, he is moving. Smart mask. The aneurysm is 2 millimeter. Aneurysm is 2 millimeter. Okay. Okay, from the lateral view, it looks like we are inside the aneurysm. Yes, we are in a good position. Yes, I forgot to inflate from the beginning, but now you can see the balloon is properly prepared. And now we can take a 2 millimeter coil. Yeah? Бах! Спираль. Шкафты ашып салшы. Так, 2,5 ғой да анау? Но 2 дұрыс болатын шығар, наверное. 2,4 бар ма? 2,4 гиперсофт. И 1,5 4 сразу алсаңыз. И отделялкасын дайындап қоясыз. 2,4 ашып бересіз. Қажет жоқ, қойсыз. 2x4 helical microplex is hypersoft. The first coil. And the second will be. Yeah, ашып беріңіз. And the second will be microplex 1.5x4. We undersized in the purpose. Oh, next. Okay. I inflated the balloon, but now I will deflate the balloon to give the mobility to the headway 17. Okay. Now coil inside the aneurysm, but small part is went out from the artery. Let's do remodeling. Now I'm sure the catheter is inside the aneurysm and there is no problem. Okay. Detached. Тағы да 1,4 перисонс микроплекс. Okay. Next go. Смарт мозг. Просто смарт мозг. As I'm mostly doing orientation on the lateral view, and it's very important to pay attention to the coil, how it's going inside the microcatheter. It looks like there is not so much space, but I hope we can place the next coil. Okay. Right. Smart mosque. It looks like it's okay. There is not so much pressure inside. I hope there is no. It looks like we can place one more coil, but we are planning to do stent assistance. That's why maybe it's enough, huh?
I think so, yeah.
Yes. And it looks like the small part of the coil is a little bit outside of the artery. We have two kind of stents. One stent is Leo Baby, and also we have Acero Hill. Baby is better, yeah?
Baby. Acera Hill?
Hill. Acero Hill.
Он потом выключил.
Baby veriyoruz. Baby. Які джермовіс? Baby. Yes, Leo Baby is 2 millimeter. That's why in 2.5 millimeter artery it will behave more like flow diverter. And I will pay attention. Пока стимит роторс. Stent work. Okay, the stent will go through the septum. Okay, just a second. Now I will take Chica Black to reposition my headway. Суы келді ма?
Келді.
Қазір бір секунд. Пока тұра тұрсын, салмай тұра тұрсын. Итірер. Okay, through the scepter we now start to deliver the Leo baby. Okay. It's a 2x25, that's why the position of scepter is okay. I think it's quite distal, but in the case of movement of coil mass, we will be ready to place the stent. Okay, we can prevent the coil movement with the stent. I think the catheter is now out of the aneurysm. Okay. Okay. Let's leave it here. Okay. Now we can deflate the balloon. I hope the coil mass is stable. It's quite stable. And then we can open the stent. Okay, now I think, okay, now it's better. Okay. Stop control manager. It looks like it's good. I think now is better, huh? Better visible. Yes, patient is pre-medicated with the ticagrelor, and now we can ask for the heparin. 5,000 I think will be enough. Okay, that's okay. We'll completely open the stent. It's not all the time necessary, but now I want to show you the confirmation of the stent opening. Stent is fully opened, and now you can see the length of the balloon is 15. Yes, it's for 15, and the stent is shortened till 15 millimeter. Yes, then the ability of flow diversion is better. Then it will be like a flow divert, huh? Yep. Okay, everything is moved in the position. After taking out the balloon, you could see the stent is moved. Huh? Yes, everything is okay. I will bring my guiding back. This balloon was 20, yeah? Okay. Коробкасын сұрады сыр? Қағазын. Баллон қағазын сұрады сыр. Жоқ, ол да үшінші маркер ғой, екі маркердің арасын құру керек. Екінші, үшінші маркердің арасын. Окей.
Екінші, бірінші маркер алып тұрған жоқ.
Okay, why it's look like this? Бақыт. Септердің қағазын көрсетші. I'm sorry, I need to check the scepter. Because we measured 20, but on the box it was for 15. Ана қағаз бар ма?
Қағазы бар.
Көресіңізші? Yes. Let's see the inner package. Ну ладно. Yes, with the tortuosity segment, everything is okay. So on the box it was 15, but we measured 20. It's not a big problem, but it might be confusing. Okay. It's a 4 minute from the stent opening. Now we'll do expert CT, and after expert CT I will ask Shaykhmet to do control angio, and if everything is okay on control angio he will show like this, but till the control CT I will be with you. Okay,
After 15 minutes control angio.
on the 15th minute. Okay. Okay, dear colleagues, the CT is ready, the brain is clear, Now Sheikh Ahmed will wait till the minute 15. Now is the 7. After 7.5 minutes, Sheikh Ahmed will do last control, and if everything is okay, he will show thumbs up, and then we can finish this case. I will disconnect the audio, and Sheikh Ahmed will continue till the last DSL.